Good morning, everybody. This past week on the House floor, I had a bit of a, uh, I guess you might call it a moment of clarity where things came into focus about this legislative session. I looked down in front of me and there were two amendments that were up for consideration. One was on beauty culture professionals and the other one was on deer meat processing. And I thought we cannot wait another day to start debating the great issue of our time, which is the Affordable Care Act. And how do we cover every uninsured Hoosier in Indiana? The issue of the Affordable Care Act is settled. Chief Justice John Roberts from the Ninth District of Indiana, which I represent, upheld the constitutionality of the Affordable Care Act. President Obama was reelected. We now are in the phase of making sure that we fully take advantage of this landmark legislation. There's three things we have to accomplish, and the first thing is this is the biggest jobs measure we could possibly consider, is implementation of the Affordable Care Act. Three of the top 10 largest employers in Indiana: IU Health, St. Vincent, Sisters of St. Francis. There's the potential for thousands of private sector, good paying jobs if we implement things fully. The kinds of jobs you can raise a family on. And also the kind of jobs that contribute to the greater good of our society. So that's the first thing. Second thing we need to focus on, the number one cause of bankruptcy in the nation is medical expenses. Those days need to end. The days when people lose their home or even lose their family because of medical expenses needs to be over, and we need to move boldly to do so. And then finally, and this is most important, and these are people that may not understand the benefits of the Affordable Care Act implementation, we all benefit from people not going to the emergency room. Middle class workers cannot afford to keep sending people there, is their first order of health care. We have not debated this, not even one day so far this session. We have drafted over on the House side amendments which will take advantage of our potential under the Medicaid program to make sure that hundreds of thousands of Hoosiers are covered fully, so they don't have to go to the emergency room. We have an amendment to make sure that Washington isn't going to run our health care program. We're going to make sure that Hoosiers run it the way that's best for Hoosiers, and we want to debate a statewide exchange for implementation of the Affordable Care Act and making sure that every Hoosier gets covered in a way that Hoosiers believe are important. That's what we're going to debate. We're going to use every opportunity we can in committee and on the floor, not just to force votes, but to force discussion. If the other side believes they have better ideas, then they need to start talking about them. But the days of trivialities in the 2013 session need to end, and the important work needs to begin. Senator Lanane.
Well, I couldn't agree with you more, Leader Pelath. Time is wasting, and we're less than 2 weeks away from the first half of this session being over. And as you say, we've yet to have a serious debate over this crucial issue. By the way, on the Senate side, we have been willing to do this. We've been offering our thoughts and ideas on it. The very amendments that you are going to offer next week, we are prepared to offer next week as well, to have a concrete plan to actually implement this wonderful health care plan for the state of Indiana. And by the way, the governors of Michigan, Ohio, Kentucky, Illinois, they've already said that they are going to expand Medicaid as a way by which to implement the Health Care Act. So now that will leave Indiana as sort of the island in the middle. And I don't think we want to be known as the island of the uninsured. We need to move forward with a real plan. We've got a real plan as embodied within these amendments. And, you know, I say this too in terms of we want to be constructive in this regards. We need to set aside all the sort of posturing and the reasons why we can't do these things and start finding the ways in which we can do these things. And there is a way by which we can do these things and do them in a way which will benefit. I think it's been estimated that we can insure 400,000 more Hoosiers if we do this correctly. As you've pointed out, Leader, we can lower the premiums. We can make sure that the uninsured costs are not passed on to the rest of the consumers. We can save Hoosier families from bankruptcy. And there have been studies done as to the economic development impact of this in terms of creation of jobs. The state of Missouri did a study which shows that in their estimation for their state, they're going to create about 25,000 jobs. And these are going to be decent paying jobs. These are going to be health care, industry related jobs. So we cannot turn our back on this opportunity for the state of Indiana. But it is time. Time is late, and we need to move forward.
And I want to say, too, this is an important debate for the people of Indiana to hear. And if it gets pushed off to deadlines, if it gets crammed on the calendar with scores of other bills, the people of Indiana don't deserve that. They deserve
No.
a clear direction
That's right.
and a clear path to how we solve these problems, which is create jobs, keep people out of bankruptcy, but most importantly, start to bring down healthcare costs, which are eating our state and our nation's budgets alive.
That's an excellent point, Leader Pelath, because I have people say to me, why is it that you all, hide something or cram it at the last minute into the budget bill, for example? Well, this is too important for there to be some last minute, here it is. It's on, pages, 240 through 255 of the budget or something. Let's have this debate. Should have been having it before this time, but let's definitely have it now. Let's have it in a substantive way.